Today we get the opportunity to discuss the use of ultrasound as a tool in undergraduate osteopathic medical education. I am Dr. John Dougherty. I am the Associate Dean of Medical Education at Kansas City University of Medicine and Biosciences. And we've been asked today to discuss a process of using these tools in our curriculum in Kansas City. So hopefully today we're going to give you some examples and some ideas how you can take these simple information and apply it to your students in your College of Osteopathic Medicine. Well, before we start, I want to define our simple learning objectives. And we have a very short period of time, so we're going to keep it very narrow scope today. The three areas of definition that we're going to look at, or how would you use ultrasound in your current curriculum? And how can you maintain the osteopathic uniqueness as you're integrating this advanced tool into your diagnostic curriculum? There are several different options as far as materials and tools that you can use to accomplish this. And then finally, we want to discuss some simple learning objectives to try to illustrate how we in Kansas City have begun to use this into our everyday curriculum. Well, let's first start with the historical perspective. Back in the day, uphill in the snow both ways, as we like to say, ultrasound started off and mainly held in the areas of obstetrics and in radiology. It was utilized mainly in those areas since the 60s. When we were all in training, the people, the current medical educators, it was something that you just simply got a written report, and when we all met in radiology to review our x-rays at the beginning of the day, ultrasound was not one of the tools that we were able to review. So to us as a generation of educators, this is a little bit of a foreign concept. But as technology has progressed, you will see a demonstration of some of the materials that we have, and it has become a more practical, applicable tool at the bedside and in everyday utilization in medical education. And as a matter of fact, this generation almost expects to have those opportunities available to them. All right, so this is our problem. These students, with the expansion of ultrasound, are more than likely going to have the opportunity to interpret and apply ultrasound in their clinical areas day to day. We have to prepare them as medical educators for that opportunity. And how do we blend that in to what we have in our base curriculum without making it seem as though it's a set-aside? We want it to be fully integrated. We do not want it to be that this is a special diagnostic skill set. It should just be a normal part of what we do every day. Well, from the academic side, we have to look at several different applications relevant to our format. We need to decide what knowledge we want to impart to the student, what skills we want for them to be able to accomplish, and I'll demonstrate here what we call as an attitudinal gap, which is part from the medical educator to the student. Okay, first, needs assessment relevant to knowledge. Like I said, many of the students will be using this tool day to day as they move into the clinical realm. And we want them to begin to have not an expertise in utilization of ultrasound, but we want them to at least have the basic fundamental understanding of how the equipment works and why it works and what it can and what it cannot do. Conversely, we also have this generation of medical educators who did not grow up with the expectations of this technology, and most of the physicians are uncomfortable with delivering the material because they're not comfortable with the technology. So the other side of our knowledge needs assessment is to help to get those clinical educators to be competent and confident, so when they turn and talk to this younger generation, they don't feel intimidated because their expertise is not the level that they have in their other areas of education. So that's an important part of the aspect that we need to work on. Simple skills within our needs assessment. First of all, from a clinical educator side, where and when should this particular educational tool be placed into our classic osteopathic structured clinical exam? Again, we don't want it to be intrusive, we just want it to be matter of fact and blended. The next simple thing we need from the skills is how to work the machine. There we have the common term in the industry known as knobology, and knowing how to turn it on, knowing how to make it work, knowing how to make it receive an image that you can interpret and utilize. So that is a definite skill that you want to accomplish not only for your students but your faculty as well. And simple functional utilization, knowing how to work the machine without impairing the overall assessment. It's a little bit of a hand skill. It's kind of like suturing. Once you get the knack of it, you're good to go. And then in the lab or in the educational setting, we want them to be able to identify and do simple interpretation. Now, in all of our labs, we have a very important statement that this is a simple educational experience alone. We emphasize that this is not a diagnostic effort. So if perchance there is some individual in the lab that is being ultrasounded and there is a pathology that could have or should have been identified in ultrasound, we kind of put that barrier there to let them know that we are not trying to diagnose medically. This is just a skill set to have the students begin to learn the introductory processes of using the equipment. It also kind of covers our liability carrier a little bit on that. Now, in our next part of our needs assessment, we have what I call an attitudinal gap. The students, when they first get their hands on the ultrasound units, they get very excited. This is what they've always thought medical education would be. We can thank all of the wonderful TV shows that everything that happens on the TV show was usually in the span of a 5-year career. We know that, but the students do not. So being able to get them excited about the educational process, not just another lecture, is a wonderful part that this tool has brought in. The example that we have on the screen at this moment is the utilization of one of our handheld units in the Dominican Republic. And I have a student there with me, of which we are ultrasound scanning pregnant individuals. And many of these mothers have not ever had the opportunity to see the baby in utero. And first of all, the mothers in this third world country were very excited and didn't even know that kind of technology existed, but the students were equally excited and engaged in the process. And I think that's an important attitudinal gap that we accomplish with this tool. We previously discussed about how the faculty have to be comfortable with using this tool, so we have to get buy-in from the faculty to make sure that they agree and understand the point of embedding of the technology into the educational process, and make sure that, again, that they're comfortable using the equipment so that they will, in turn, feel comfortable in instructing the students. We cannot leave out the administrative side of any needs assessment, as any good associate dean or dean would say. And there's different aspects to a cost-to-benefit ratio, if you will. This is an indefinite recruiting tool to try to accomplish those students that have the aptitude towards technology to come to your university. And matter of fact, at the meeting we just finished, there's a couple of universities that are promoting their use of ultrasound as a tool to recruit students. So I can't understate the importance of that aspect of getting students into your program. Of course, there is some budgetary restraints. In the past, the units, the very large units, have run over $150,000. The newer handheld units, which we have been using, run in the between $7,000 and $8,000. So that dramatic change in the cost aspect has made it a more practical, applicable tool for us in laboratory and in educational opportunities. Of course, accomplishing the equipment is a direct expense. Instructional training, curricular development, and justification towards giving the time for the faculty to do all of the things we've discussed are all indirect expenses, but things that you don't want to overlook when you're beginning to look at implementing this into your curriculum. And then, of course, technology, as we very well know, has a lifespan to it that we need to take into consideration. Those are all different aspects of an administrative side that you want to look at when you're considering implementing ultrasound into your curriculum. Well, we have, at our university, had the opportunity to accomplish our curriculum with a handheld unit that comes from one of our companies is General Electric. And as you can see, it's a very small, very mobile, very simple to use piece. This particular unit has preset knobology, if you will, which makes it a lot easier for us to apply into the laboratory experience, to use in the field. We don't have to have a skill set that is independent and separate from what we will need to have accomplish day-to-day operations. The presets on this particular unit are for cardiac, obstetric, and abdominal examination. Another important piece of the overall total package of this particular unit that I enjoy is that they have online asynchronous didactic material, including formative tests that we apply in our lab. An example of this is demonstrated here. This particular demonstration helps the students to be able to apply their knowledge base immediately. We play this video during lab, and they have a very quick and rapid ability to understand what they're looking for and what it will demonstrate and the overall ability of the educational tool. For those of us that have not had this, we usually would have this in a typical plain slide in a lecture. So the illustrations utilizing the high-end multimedia graphics really makes an impact on the students and helps them with their comprehension of the overall goals and objectives of the particular lecture. We also have, within the didactics, we have to have a progressive curriculum. You want to begin to slowly introduce the concepts, the information, and there are available now simulation manikins that you can ultrasound and consistently have the same results for every single student. And those are becoming more and more widely available. There is some expense associated with that. That will be a direct expense. That's something you're going to want to consider as you're making the decision process to going into ultrasound. As far as integration, this is a very important point that our clinicians were concerned about, especially some of our more traditional physicians. They were worried that we were going to remove our osteopathic palpatory skills and supplant it with ultrasound, and trying to get the students just to go to look for the visual as opposed to the old skills of observation, auscultation, and palpation. That is a very opposite dynamic that we're actually trying to utilize the ultrasound technology to augment those skills. When the students get visual confirmation of what they're auscultating or what they're palpating, the embedding of the information to them, their uptake is much quicker because they get positive reinforcement as opposed to having questions about, well, yeah, I think I feel that. In these circumstances, they can see what they're feeling, they can see that aorta pulsing. This does have a color Doppler application to it, so they can actually see the blood flow as they're feeling it. So it's a much improved ability in the lab to support our traditional osteopathic clinical skills. These are some just examples of how we have used the learning objectives for ultrasound as it relates to our osteopathic clinical skills labs. As you can see, these learning objectives are what we have traditionally accomplished some other way, either with palpation and probably, particularly as it relates to gastroenterology, the students have the biggest impact on Murphy's sign. We have them identify the gallbladder and then compress the gallbladder and watch the gallbladder compress on ultrasound. And as they release the gallbladder, they can see it re-expand. So to be able to take that concept and give it a visual support really helps the students as far as comprehension. Also have some examples of cardiovascular learning objectives, and these two are not the only two to which you can apply. Also within your coursework, whether it's renal or GU and or reproductive and obstetrics, there's other opportunities with the particular unit that we have. Other different ultrasound units will probably give you the opportunity to move into some of the others, especially musculoskeletal. The unit that we have at this time does not have the ability to do musculoskeletal. And the final portion of the academic consideration is going to be your outcomes assessment. There has been some challenge with standardization. The manikins that we discussed are beginning to have some improvement on that. Opportunities lie within lab practicals, human patient simulators, and to try to integrate appropriate use of ultrasound in the clinical scenarios, all of which creatively can be accomplished depending on what your perspective and priorities are. All right, so to summarize, osteopathic medical students do have a very high likelihood of encountering ultrasound once they begin clinical rotations. So to prepare them for that, I believe, is an important aspect of their undergraduate medical education. These tools will, along with the multimedia materials that is supplied with them, will help the students become more engaged and an active learner into the teaching process. And there is wide open opportunity to continue the use and further explore the use of this educational tool into our osteopathic undergraduate clinical education. Thank you very much.